Thank you for being here. I know some of you have drove for long distance to come and see this lecture, so I'm going to make sure it's worth your time and worth your effort. I'm going to speak in English, so if somebody have a problem with a certain thing, raise your hand and then I can speak it in French or Arabic, whatever you want. Some of you have, when I came in, they showed me some of their results. Amazing, amazing, amazing. Kafir, some Dr. مين they can say أيوة دكتور very good results. So I'm happy to see that. I'm always happy to see that. So I'm going to talk to you right now about the fundamentals. I know I was supposed to be here before, but because of COVID, I was not able to. So I'm going to show you how it works, why it's important to be part of your portfolio in your clinic. This technology has been developed since 2006. It's not new. Safety profile is impeccable in terms of the efficacy. You're going to see some of the data that have been published. And then it's very important for you to know exactly the underlying mechanism so you know you can push it even further. So I call this talk Update in Regenerative Medicine. And the reason I say this is because really we are developing things as we come. Like now and then there's something new that comes up and we start integrating it and finding new things. So some of the work I'm going to show you is not mine. It's somebody like you who are so enthusiastic and went and published it in big journals. Some of them are universities, so you can see some of the data. So when we talk about regenerative medicine, and I always say, a lot of the time, because of our medical specialization, we feel like, well, this is not my field, this belongs to somebody else. And I get it. So if we talk about filler right now, maybe a gynecologist will not say this is something for me, or a cardiologist said, I have nothing to do with this business. But when it comes to regenerative medicine, it's uniform through all disciplines. I don't care what kind of business you do, what kind of specialty you are in, you have something to do with this. And I'll show you why. Because regenerative medicine is a branch of medicine that develops methods to regrow, repair, or replace damaged or diseased cells, organ, or tissues. This is what medicine is. This is what they have disease. Either way, something related to medicine in general. And when we talk about regenerative medicine, we talk about really three main components: growth factors, stem cells, and exosomes. And I'm going to handle each one of them in a category. So, and I'm a professor at the medical school, and we talk about a lot of theories and we talk about a lot of information. And a lot of the time, the student, they will follow the first minute and they go like this because they lose the ends. So the best way to explain something, when you want to teach your kids, you want to teach anybody, and you want to show them the best way to explain something is by doing visual. If they see it, they believe it. If they believe it, they understand it. If they understand it, they remember it. Okay? So the best method of showing, teaching something is visual. And because of that, we made this video. It took us, I don't know if I tell you how long, but. So this video really, if you understand this video and then you walk out, you got to understand all of, after this video, I'm going to show you just evidence. But this video summarizes everything that you need to know about regenerative medicine. So what we did, we took a skin, we caused an injury to it, as you see here. And then we want to see how the body repair it. Okay? And we put a microscope with time lapse. So we took a microscope and then we filmed it for around 12 hours, 24 hours, and then we follow the whole process. So we caused the injury here, you see, and then what happened? This is wound, and then in this area, expression of growth factors. So in this case, it's DF1. This growth factors cause the blood artery here to open up. And this cell here just came out, you see, and it's round. Every time you see a round cell, stem cell, and it starts migrating toward the wound. You see there's other cells, like this one here, like macrophages. And we see macrophages, monocytes. A lot of cells start migrating to this site of injury. Now, my question to you is, why they didn't go here, away? Why did they just all come to this area here where there is an injury? Who told them to do that? Who told them to switch to come and fix this area? You know, how did they know that? And this is known, this done is by growth factors. So growth factors are signaling molecules. I communicate to you right now, my voice translated to you two things. Our bodies, they speak too, but not with audio. They speak with chemical messengers, okay? Protein, our cells have a lot of receptors around it that is responsible for things. So if you attach the protein, the signal to specific receptors, you send this message that what you want the cell to do, okay? So now the growth factors recruited all the related cells to repair the site where there's damage, right? And based on the damage, so here in this case we did the physical, we just took a needle and boom, we caused the damage physically. But if it's chemical damage, if it's heat damage, then the response is different. So far we follow?
Yes.
Yes, good. So stem cells move from the artery and they move to the site. So that means stem cells require growth factors. And then stem cell will come to this site, and based on the type of damage and based on the signaling, they will transform to become functional cells. Because stem cells, they're not functional cells until they are activated and transferred to functional cells, right? They become fibroblasts, keratinocytes, and whatsoever. So in this case, the stem cell moved in and caused the transfer to fibroblast in this case, and then start building the damaged cells. And this is how regenerative medicine is. We like some component of it, we take it and we put it in to help the body repair. You will not see a kid with an acne scar or with acne or pigmentation of this problem with their skin, because the amount of growth factor produced is higher. The more we get older, the less we produce sadly. So this is some of the component why we say these kind of things. So since you understand this, let's go to practicality. Now, we developed something called growth factor technology. It's patented globally. I usually put these 3 patents because I don't want to overwhelm the slide, but it has US patent, European patent, and Japanese patent. These 3 offices patent is the highest in the world. So if you come to me, I have a technology I developed, I got a patent from Bahamas. With all due respect to the Bahamas, it's not really a competitive field. So having patent in the US, Europe, and Japan, pretty much the top, and the reason I put this to show you that this technology is actually real, it's not something, So, and we also developed something called, and this is a trademark for GFIT, growth factor induced therapy. What does growth factor mean? Growth factor induced therapy, that means using growth factors in modalities, in combination with modalities. So if you put growth factors with microneedling, as we showed today, with radio frequency, with lasers, with chemical peel, this process is called growth factor induced therapy. And we have a certification process, so you have to go through training and things to get certified to be growth factor therapist. So this is what growth factor therapy means. Let's go to paper. So this paper published in the Journal of Cosmetic Dermatology. It's peer-reviewed paper, and it was done by the Academy of Aesthetic Medicine in the UK, University College London, King's College in the UK, and Chirurg Esthétique in Toulouse, France. So it's multi-centers done by universities. And here they look at rejuvenation in general, but they said we combine growth factors with microneedling in 3 different groups, as Asian, Caucasian, and Latinos. Why these 3 groups? Because they represent general skin types, right? And they want to see if there is any difference in using this different modality. Will Asian respond better than Caucasian? Will Caucasian respond better than Latinos, and so forth? So they did this, and they pointed out here they're using AQ recovery serum for their treatment, and they use microneedling as a delivery growth factor therapy. Remember, you use modality. And here they look at improvement of patients by age group. And they found that the most improvement takes place when you are at the age of 40 and 49. And I guarantee you, if you go look at your appointment book right now in your clinic, you're going to see a lot of your patients fall under this type of age, because this is when they really, you know, if somebody comes to you, they're 30 years old, and they ask you how old I am, you'll have a hard time thinking, I'm not sure. But when they pass the 40, some of us, you're 40 something, aren't you? We know. So, and this is really when the turn is. So it makes great sense, because these authors, they send it to me, like, we found a lot of changes during this group. That's normal? I say, absolutely, yes. And then they look at this indication. They look at the brightness of the skin, overall skin texture, appearance, tightness, pores, wrinkles, and pigmentation. They look at a lot of indication. And they show that it had improved all from the baseline, have improved to all given indications. And they use like a device called Visia with a specific software that will measure all these indications. So they conclude, this study used AQ growth factors, and they said the reported efficacy of this treatment modality cannot be extrapolated to other growth factors. So basically what they're trying to say is, if you go and use other growth factors, other brand, you know, which I don't think there are, but there's fake ones, you cannot say, don't use this paper to justify using other growth factors. This is what we did, is using these growth factors for the treatments. And they said a source of the growth factor is important, and manufacturing should be done in a pharmaceutical facility. A variety of sources are used to obtain growth factors. This include recombinant bacteria and stuff like this. So they said the importance of these growth factors is you have to make sure that they are real, and they are manufactured in the proper way, and they have all these things to get this type of results. Okay? So it was a really good paper, published 2021, almost a year ago. This paper is my favorite, actually, so this paper done in April 2020 in Egypt by the University of Cairo and then the Center for Research in Cairo. And, you know, if I try to do this study in the US, I will have a hard time getting approval, frankly. Because what they did, they took a patient and they did split face in the patient. One side is using fractional laser. So they look at the title. Clinical and histology assessment combining fractional CO2 laser and growth factor versus fractional laser alone. So one side is fractional laser, CO2 alone, and the other side, CO2 laser plus growth factors. And they want to see if there's a difference. Would the growth factor make a difference or not? So they use the DECA system as a source for lasers, for fractional, and then they use the AQ recovery serum from AQ solution as the source of growth factors. The first thing they saw when they look at the fractional laser only treated side, the healing was almost 11 days, 12 days average, the healing. When they combined with growth factor, the healing came to 5 days, 5 and 6 days. So cutting the healing time to half. Why this is important? Why is it important to cut the healing time to half? Because the faster you heal, the less complication you have. Because healing fast, that means less inflammation. So you have a problem with it, like for example, somebody like my skin will have post-inflammatory hyperpigmentation, other issues with healing. So the faster you heal, the proper and the better results you will get for your patient. So they said here healing is much better, so no less complication and stuff. The other thing they found out, that also the healing is better. So not even faster, but the healing is even better. And you can see somebody asked me one time, it's darker here, and they explained that in the paper. They said, because a lot of the time when you are Fitzpatrick 3 and 4, and you have a laser, ablative laser, and remember this is scar tissue, so you have to use a little bit stronger pulse, then it will cause inflammation, and then the patient develop pigmentation. So here they said, using growth factor, not only we have faster healing, but we have better healing with better results. They said they showed here. So the conclusion, and they said, unfortunately, ablative lasers are still associated with some side effects, especially facial scars of darker skin type between Fitzpatrick 3 and 4, and they said swelling during the session. Hyperpigmentation or hypopigmentation were more reported dark skin type and sunny. So people in Egypt and people in the Middle East and people here, they will have hard time when they use laser because of the post-inflammatory complaint. So here they said using growth factors have minimized this issue for people who skin type like us. And then they also pointed very interesting thing. He said some authors suggested combination of platelet-rich plasma with fractional lasers. And here they said that using PRP as a source of growth factor is not a good idea. Why? Because they said unlike exogenous prepared GA cocktail where the doses of GA is calculated accurately. Here they say when you use something like recovery, we know exactly the percentage of growth factors in it all the time, and we know the combination. When you do PRP, if you I take a PRP for me today, then a week later I take a PRP and I look at the growth factor, they'll be different. So when using studies, you know exactly what you're doing all the time, and you know exactly the outcome for outcome. So they say in this paper, they suggested that use of exogenous is always better. I put this paper because I want to show you diversity of things, and this paper is very cool. So they look at growth factor preparation for management acute radiodermatitis. Many of you might not know this condition. So acute radiodermatitis is the condition that happens when people take radiation for cancer treatments. So look at this. Oops. Oh, look at this. 95% of patients will experience substantial skin reaction for the treatment. So people who use radiotherapy as a treatment for cancer, which is a lot, 95% of them will develop radiodermatitis. And they say in this paper, at present, there is no anonymous agreement regarding recommendation to the prevention or treatment of radiodermatitis, despite the publication of journal guidelines. So despite 95% of the people will get this, until today we have no set treatment to treat these people. So here they suggested, an alternative treatment, and this is how it looks. So radiodermatitis, this is how it looks. It's very scary because you experience radiation, ionized radiation, and causing burning in 3 different layers of your skin. So it's like, and it doesn't heal, usually scar, and it's nasty. I don't know if somebody have experience with it, and God forbid any of you will have to go through this. But you actually, if you are doing the radiation, we ask the patient to pull a mask on top because of the smell too. The smell is radiation plus burning. It's not good. Anyways, so this is how it looks. So they suggested here using AQ active serum. In this case, active serum, the AQ is standard concentration, and they asked her to use it twice during the treatment on the lesion area. And then they follow the patient throughout the treatment. This is how it looks like. In the treatment of 6 months, there was absolutely nothing. So the conclusion here, that skin reaction to treatment with ionized radiation for the breast cancer can be both physical and psychological. And I met the authors, and I was very, very. I'm sorry? Yes. So I'll explain this question. So they said unfortunately, when a lot of us, when we look at this, we look at the physical part, how I'm going to treat this. But we forget the psychological component of it, because this patient had cancer, and now she has a scar to carry about and burning, sensation. So here they suggest this treatment is ideal because it showed rapid and orderly healing. Rapid, that means fast. Orderly, that means correctly healing, with significant reduction in pain and virtually no scarring. They hit the nail on all the things, because the patient who goes through radiation, you wanted to make sure they are psychological, they're upbeat, they don't have pain, they don't have scar. When they get recovered, nothing in their body remind them what happened a year ago or so on. So it's really good paper, and because of this paper, and because of the efficacy that's been used, this product that what they used, it won the Al Chevron Award in 2021. It was really a testimonial for the product, as well as the medication. This product was designed for anti-aging, for things, but knowing the technology behind it, it has been quite interesting. This paper came out also last year in August. So, less than a year actually. And here they look at chronic diabetic patients. And this patient have a tibial problems, and they develop chronic wound. They couldn't heal. He's 67 years old with diabetic, type 2 diabetes. And this is their wound. So, so here they said we're using, they clean it with hydroxy peroxide, and then they use the acute recovery serum, as you can see. So they take the length of the wound, and then some people ask me, why do they have to stick scissors inside the wound? Because when you characterize the wound, you have to do 3 things. You have to know the length of the wound and how deep it is. So this is how you measure healing. So they did this, and then they apply recovery serum on top every 2 days here, they say. Or they showed that day 10, day 13, so every 3 days they start applying the recovery serum on the patient. And it healed. Now, I don't know how many of you deal with wounds. It healed in 20, you see, it's not as strong, the laser, in 27 days. In chronic wounds, 27 days is actually speed lightning. Trust me with this. And you can see also the healing done. You see, the scar is actually not even there. It heals better than the one that without the growth factors. So, and the patient is 65 years old with type 2 diabetes. So they're very, they're calling this is really breakthrough in using for wound management and care. And tell you the truth, we do a lot of it, a lot. And I took a lot of talk, but in the thousands of cases. Don't take pictures of this patient. I don't have consent. Soon I don't need to ask you this, but now I have to ask you this. It's an inside joke, sorry. So this patient is 92 years old. Her name is Ruby, very nice lady. She's in very good health, and she's have type 2 diabetes. She's taking blood thinning medications. She's taking also Lipitor for her cholesterol. And she developed melanoma in the side of her cheeks here. You see the square? So the doctor decided to take it out using more surgery, just to cut it out and take it out. During the surgery, when they cut it, she continued to bleed. And I think they didn't give her enough time for the thinning medication to wear out, so they didn't give her enough time. So the coagulation is not there. So the doctor decided to cauterize the artery to stop the bleeding. While doing that, he forgot the oxygen tubes in her nose. So what happened when you have spark and pure oxygen?
Explosion.
David said, explosion, explosion.
Wow.
Everywhere. Her son David is a very good friend of mine, and he had the same, he had growth hair on his forehead, and they removed it, and then there was a scar. I was treating his scar. So he sent me this picture, and he sent it to other doctors too in the area. He lived in Beverly Hills in LA. And he told me, anybody, this is what happened, can you help my mom? Can you have any ideas what you can do and stuff like this? And some people suggested other things. So I told him, I said, David, don't worry, we'll take care of it. I think it's manageable. And literally what I did is cleaning and applying recovery only. Nothing else except applying recovery topically with no treatment at all. You want to see how she looks now? As if it never happened. She's 92 years old with diabetes. So of course, I go see her to see how she's doing. And she told me, I wish the fire went everywhere so I can have a new face. She's very funny. I put this because regardless of age, really, regardless of age and condition, having the right growth factors at the right pace and the right will cause improvement in the patient. This is another patient of mine. So what we did here, she came to me asking for Botox and lips. So she's like, I need fillers because I need my lips to go like this, and I need a little bit here and stuff like this. And I said, lady, you have a bigger problem than that. And I said, injection will not help you unless you fix your skin. And I cannot say this enough. to people who do aesthetic, you know, and I show a lot of these cases when I give another lectures. If you don't do skin, your skin is not good, don't bother do filler and Botox, because all you're gonna do is you're just gonna make the bad situation become worse. So she came to me and I said, listen, let's take care of your acne, and then we can do the rest. And she said, I've done everything, I've done medication, I've done this, it didn't work. And she's 30 years old, right? And I said, let's try something else. So we did this. So I did treatment for her March 15, 2012. Then she came back in April 10, 2012, and she has significant improvement. And there's a little bit left in her forehead, so we decided, I told her to come back again. So she came back again in April 8, after a week, 18. We did the treatment here, and then May 1st, look at her face. Like she never had. Really creamy, never came back, like never came back. But look at her lips. I always tell patients, do not use makeup. I know some of the Instagram, they put like red lip and they put gloss that look juicy and full and stuff. That's not really the result. No makeup, you see the difference. Look at before. A totally new person. So, should I have done that before I did her acne, you will be like going like this. So it's important to fix the skin before anything else. So we're gonna move away a little bit to the skin and we'll talk about hair. This paper came out in 2017, and this was done in two centers, one in Shanghai and one in Beijing, in universities in China. And if you are in the hair business, you probably heard about this paper. This paper caused a lot of waves in the industry of hair. You know, it was presented in Prague at the hair meeting, and the reason it was, for two reasons, it was very popular. They show improvement rate of 93%, which has never been recorded for any hair treatments. Finasteride, minoxidil, nothing. And the other thing that made the wave, they did something that usually us in the West will not think about. They used the same patient, they did split hair treatment between hair and this. So imagine me in the US telling the patient, okay, I'm going to treat this area here, and this I'm going to leave this here, and let's see what happens. To be no-no. So they did it in China, and this is a really good way to find out if really the work, there's a difference in the same patient. So they did this, and they showed the results. So they said there's growth, but also they went to the extra strength, and they wanted to show not only you have growth. This paper is in our website, so you can download it all. You don't need to take pictures. So not only that, they showed also the quality of hair is better. So here they talk about comparing the quality of hair with minoxidil and finasteride as opposed to using steroids. So they not only you have hair growth, but the quality of hair is much better. And they showed the thickness of the hair 30% thicker hair and then the normal. And you can see the double, you know, you have this, the follicles are working really well. And again, they use the AQ hair complex for the treatment, bilateral treatment with the AQ hair complex. And they showed the 2 mil hair, they showed the protocol hair and how they used it and how this. And of course, after this paper in 2018, we won the award of the best product, hair product of the year. Actually, until today, no hair product have won this award. So this is the last, and nobody won it in terms of hair. So it's pretty cool. So I don't want to take long with that, but I will not be a really good friend and speaker if I don't talk about the darker side of this business. I like to speak of romance all the time, but I sometimes it's my job to make sure that we understand the science and understand what goes on. It's not good for me to tell you about something without making sure you see the other picture and also protect you from other things. So, but you should answer this question right now. Do stem cells produce growth factors? What the answer? Yes or no?
Can you ask the question?
Do stem cells produce growth factors? I showed you the video.
No.
No. Do stem cells require growth factors? Yes. So because you know, and this is business / political, what you can do it, you can analyze it the way you want, but There's two companies that own the patent to this technology. There's an old patent that's owned by Allergan, and then there's a new patent that's owned by us. And because of these two patents, this field somehow became restricted for other people to come and do it, right? And really, I believe when I tell you it's nothing to do with me, but Allergan is the one who sues people who try to come too close to this patent. So because of that, and now growth factor became one of the most important part of the clinics. So people have, before nobody used growth factor. Now the first treatment in the clinic is Botox, then fillers, then growth factor treatments for skin and so forth. So it's a big business. So these companies need to be in this business. So the way they do it is they said, hey, we have growth factors from stem cells. Because remember, stem cells work close relations with growth factors, and a lot of people don't know the difference. They don't know how stem cells work, and it's very vague science in a way. So for the normal people, they call this stem cell from growth factor from stem cell. And they tell you this mesenchymal stem cell because bone marrow, and they give you all the stories you want to hear. And it sounds so nice and sexy. It doesn't hold water in science. It doesn't have a patent. It doesn't have a publication. But, or they show publications public in open access online, which is 10-cent award. But they know a lot of the doctors, physicians. I teach in medical school. I don't teach my students about this kind of stuff. So it's easy to trick you guys, and it's easy to trick the people and tell you, hey, and then they give you the price, and this packaging is so nice, and the whole work. So go back to basic biology, please, when this comes in. Go back to, so stem cells do not produce growth factors. Now, another common misconception is using growth factor from plants, because this product is organic. It's come from this fruit that is in Switzerland. It's very rare, and they give you this, like Cindy Crawford, every Sunday you see it in the news right there. And they tell you it's organic, it's so nice. I mean, I think of myself as a flower, but my DNA does not agree with that. So regardless how you feel emotionally, science is science. Plants are different species. They have different DNA. You're not an orchid or rose, as much as you like to think like this way. But your DNA says otherwise. So using growth factor from a plant will not work on human, just because we're different species. So while we like to think about organic and nice to eat, but skincare and using it is a different story. So please be careful. Now, I don't like to talk about other brands. I don't like to talk about things because this brand I think doesn't exist anymore or something. But I want to give you an example. And I want you to, just to show you how things are, and then I'll tell you the story. So this was in the aesthetics. It's a magazine that gets published in some conferences. Look what they say. The aesthetic examines the science and the uses of a new skincare range that is formulated using the stem cells from an umbilical cord lining of a New Zealand red deer. Yes. So what they did, they went to New Zealand, they found red deer that giving birth, and they went there and they took the umbilical cord to give you a skincare line. This product was sold in the market. And I know some doctors, friends of mine, were giving a lecture about it. Like, yes, the tunnel of life, where kids come with their life start, have a lot of secrets. It's the umbilical cord. They start giving you all this nice emotional thought with zero science. So it is important that you know that. Now, the FDA also doesn't like this kind of stuff. So the FDA sent warning to company for making dangerous, unproven stem cell products that put patients at risk and puts other stem cell firms, providers on notice. So in the US, the FDA usually send a warning notice. They don't cite it, they send you a warning for these companies. And remember, see, December 2018. Of course, a lot of the company, they're like, we don't care. So in 2019, the federal court issues decision holding that US stem cell clinics owner of adulterated and misbranded stem cell products in violation of the law. Now in the US, it's illegal. A lot of the time, the clinics, they don't take it this way because they think like, well, I didn't make the product. I mean, I sell it because they told me so, but it's not me. No. In the US, you're liable. You have to make sure this, whatever you bring to your clinic and give to your patient, you know what they are. You can't say, well, they told me. No, the judge doesn't care a lot about you. They told me and who told you. So you have to do this. So in the US, it's not legal. the stem cells and all this propaganda craziness is not legal. So a lot of these companies found themselves in the US have no business. So what do you think they did? They went outside the US. So if you produce in the US and you don't sell in the US and you export it, the federal court and everyone in the US, they can't care less. As long as you sell somewhere else, then the other countries is a problem. So you start bringing it here. I know one product is going to be here right now. I have one told me about the distributor of that company told me that it's coming within a month or two. He's like so proud. And there's selling around, other countries. So you need to be careful. And the reason I'm not talking this because of competition. There's not a competition, but the reason I'm talking about this is because of this. I get a lot of cases telling me, and sometimes I get calls from doctors internationally. Don't take pictures. I don't have. Not now. In the future, you will be able. I wouldn't care. Now I have to. Patient. I don't have. Anyways, so I get calls from angry doctors telling me you're talking MCAS and you said growth factor great for wound healing. I use growth factors and my patients are now in trouble, and I hold you responsible, frankly. And it's like, okay, which growth factor are you using? And then I hear all the crazy names. So please be careful, fake growth factor. A lot of them we think they're not harmful, but trust me, they come. This patient, for example, in Indonesia, he developed lesion and atopic dermatitis for 6 months, and they treated everything. And then, when they found out I was coming to Indonesia, she came to see me, and we fixed her. But I see a lot of cases, so please make sure. This patient, she have a wound in her finger, small wound. It can be treated easily. They use growth factor on her that is from Korea, I believe, or somewhere like this, and it got worse, and we have to amputate this area. And then this one we've saved, but this one, no. And the doctor called me and said, I hold you responsible because you're the one who's talk about growth factors. I said, I talk about good growth factors. I didn't talk about weird growth factors. So anyways, so that's one reason why I put this and emphasize it, not because, other reason, but just to make sure that you guys hear the point. Now, with all this said, we have to talk about safety, right? So this paper published in 2012, and they said, in vitro evaluation of the safety profile of cosmeceutical containing growth factors and their analogs. And here they talk about normal human fibroblasts were evaluated. Now I met these authors and I told them, why did you use the name normal? Why did you say normal? I mean, human fibroblasts, you need to say normal. You know what I mean? And they said, because there's so much craziness. We want to make sure they understand. We're not talking about some weird cells. We're talking about fibroblasts, normal fibroblasts. And the conclusion, cosmeceutical product containing fibroblasts, growth fibroblasts, active principle considered to be safe for application. So remember, they look at what? Fibroblasts. They didn't look at stem cell, they didn't look at a plant, they look at the fibroblast growth factors and as being considered to be safe. Now, we are good so far? I can conclude? Okay, so before I conclude, recently in the last 2 years, a new trend just started in the US, and I have a feeling it's going to come over here. It started from Korea, and then they are very smart. They bought the facility in the US, and then they transferred the product from Korea to the US, and then they made it made in the US. So, a lot of countries now, they're stopping Korean product from coming in, especially cosmetics. So now they're going and saying, this is a US product, because this is our office in the US, but it's made in Korea. Anyways, and they talk about what? Exosomes. Exosomes are small vesicles that are produced by cells. All cells produce exosomes, all. We find out lately that stem cells, special type of stem cells, when treated in a certain way, they produce exosomes that have shown improvement to certain conditions. To understand? They're not as powerful as growth factors, but they are associated with certain type of improvements. But for the exosome to work, you need one major component. The cell, a live cell, have to come in close proximity to another cell and talk to it. So if somebody comes to you and gives you, this is exosome, and you take it, you put it IV, exosome, they not have markers, they're not cell, they cannot go, they don't respond to chemokine and they go to the inflammation area. They have to be approximate, they have to be cell to cell, and then they produce it, and then this exosome doesn't have a receptor on them, or they don't go through the cell through receptors. They go through a process called pinocytosis. So they go in, they leave the cells and they go inside the cell without receptors. So there's been a lot of study right now. Actually, I got the patent in 2015 of how to generate this exosome. And I've been doing a lot of experiments to see how I can use them. To date, I have no clue, frankly, just to be put it there so you guys know. And I'm part of the exosome societies in San Diego, and we still try to figure out. Suddenly this company comes and say, hey, I sell you have 2.5 billion exosome and 5 billion exosome. Beautiful package, nice stories, and all the weird things. So this is the fundamental. Cells have to talk to each other, and in this close proximity, you cannot take exosome IV and say, you know, I took exosome IV and I feel better. You can do this with stem cells, because stem cells can respond to chemokine to go to the site where there is injury. Those are very small, tiny particles. They're not cells, you know, and they carry inside them a micro RNA, miRNA, and some proteins, some lipids, but mostly what they carry is microRNA. And we believe this microRNA go to the cell and then gets expressed in that cells to make it do something that is cool. I don't know what. So this is how exosomes are. And they carry composed of lipids, proteins, mRNA, messenger RNA, and mostly miRNAs, which is microRNAs. We don't know a lot about them. We don't know how they work so far. We know the physiology about them, we know what they do, but we don't know. But it's a very good story to tell, and it's a very cool story to tell for an aesthetic field, because the science of the aesthetic fields, with no disrespect, a little bit in the low side. So with the new packaging, a new story, a new flair, and you have a doctor who looks good and speak well, and he's like, exosome, I did this, and stuff like this. The science does not back it up. And sadly, it's not, I know 2 months ago I was told there was an issue with the FDA that issued against exosome users and so forth, but I haven't seen it, so I cannot confirm to you, but somebody told me today. So, when you hear exosome in a bottle, I want you to be very, very careful, and I don't want you to go crazy. But, for whatever reason, you decide to use exosome, then you have to understand something. Exosomes are, you can take pictures. Exosomes are genetic material. When you go transfer genetic materials from what you don't know where to your body, then you have to understand this can interfere a great deal with your own genome and can cause you. So there is indication of cancers, pulmonary hypertension, acute bacterial infection. You know, even there's indication for people who have like dental work done, they start getting inflammation around that. And so forth. Immune compromise also, of course, because you alter certain things of your markers. So please be careful if you decide to go with exosome. I don't know why you should do, but if you do, please keep this in mind. You're dealing with a little bit unknown, and there's a lot of things that can go wrong. So with that said, thank you for your attention. Thank you for coming here. Thank you for your hospitality. And I'll take questions for you. You can also contact me on Instagram if you have any questions. We have a mic, so if somebody wants a question, or you can just yell it out. Any questions?
PRP,
Yes.
PRP produced growth hormone, correct?
PRP?
Yeah.
What about it?
Platelet-rich products, they are produced growth hormone.
Produce what?
Growth hormone.
Yes, growth
The
factors.
concentrated PRP.
Yes, so
Produces growth hormone.
I know what it. So PRP, you're asking PRP have growth factors. Yes, growth factors can come from PRP. However, you don't know which growth factors and which concentration. And what the point? What will be the point to combine both growth factors from here and then with PRP?
Can you explain a little bit about the practical procedure and how to use them, the products?
Yes, we'll do it now after I'm done, but I'm taking questions. So PRP, you know, I think it's public knowledge now. I don't like PRP. I'm against PRP. I have a very good friend of mine who got in trouble because of PRP, and I always tell him, you don't need to do that. He's like, hey, I use it, I use everything, I'm keeping everybody happy. The problem with PRP, remember, growth factors are signaling molecules, right? They go through receptors, they're very specific, and you need two components for growth factors to work. The right concentration and the right combination. You can say, oh, I have a lot of growth factor here. That's not a good argument. This is actually a bad argument. But that can cause a negative response in our body. So you need to, when growth factors have function, each one of them have function. So you need to have the right component, the right combination of these growth factors. For, like the hair growth factors are different than the skin growth factors, are different than from the lash growth factor, different from the eye growth factor. Each growth factor are very specific for a specific indication. So you have to have the right component, you have to have concentration, you have to have all these things for the growth factor to work. Doing PRP, you have everything. You don't know how much of this. For example, I see people injecting PRP in their hair, like, it's good for the hair. TGF beta is good for the hair. TGF beta, there's 1, 2, 3. So there's TGF beta 1, TGF beta 2, TGF beta 3. TGF beta 2 is known, hugely published. It wipes the hair follicles. It kills the hair follicles. It's a pro-inflammatory. Just go there and just wipe the hair. So why will you inject something like this without knowing how much TGF beta you have in there? You understand? So PRP is a source of growth factor in 1988, when the technology is very limited. Now there's no excuse. We know exactly what you want. We know you want how many, you could 3, 6, 7, we'll give it to you in this concentration. We can tailor it. So there's no need to take a blood from somebody who have hepatitis C and try to, work with it to, for something. So it's the risk ratio for me, I think it's not good. But yes.
I want to ask if you have a list of all the growth factors that included in your product.
Dr. Faris Salama, it's a dermatologist.
Hi, thank you for this nice lecture. I wanted to ask if you have a list of all the growth factors that are in each one of your products.
The answer, we have the answer is no. We have it in the company. It's a secret company. What makes us different than everybody else is because we know exactly which growth factors for what the combination for these growth factors. If you look in our patent, we have list of the growth factors and concentration, but we don't tell you the combination and how they work. So this is company secret. This is why we're different. We like KFC, but we don't eat it. We're not that delicious.
Thank you.
But just to understand the difference of the growth factor for the skin, for the hair, this you can explain to us?
Yes, it's different.
In what is the origin of this growth factor?
Human fibroblast.
Okay, so what is the difference between the hair follicle and also the regeneration?
So, for example, for hair growth,
yeah.
one of the most important components for growth is PBDF, basically drive growth factor, PDGF. PDGF is very big in angiogenesis, providing blood support to the follicles. It's also reduce the fibrosis around the follicle. But PDGF does not work alone. You still need IL-3, you need IL-6, you need different. So the combination of these growth factors, plus what other component to them that will make them work. Now, if you put PDGF a lot on the eye treatment, then every time you apply it, you'll have puffiness and you have water dilation here because the blood supply is going up. So it's escaping the interstitial space. So you cannot use well, you can a little bit, but not so much. So this is how you balance the indication, and you differentiate which one goes in.
If I will be able to ask you later on.
No, you can, but if you have the mic, you can ask.
No.
Okay. Any other questions?
Thank you, Doctor.
Okay. Yes, so there's work done by couple of doctors in Istanbul who do a lot of hair transplant, and they was thinking, is there a way we can enhance the recovery period and then enhance the survival of the graft post hair transplant? And they were under the impression that using a PRP was the best option for that. So they part of doing transplant, they give you they send you the transplant plus 2 sessions of PRP is a package kind of thing. And they noticed that a lot when they do PRP, it's hit and miss. For example, some of the PRP have caused some damage to their results. And they don't know why. The only, for them was, oh, the age of the patient. If the patient smokes, maybe it's not a good idea and start, looking at this. But they were looking for alternatives, real alternatives. So they were attending one of my lectures, and they came to me and they asked me, I want to use it, hypothetically, as part of post-treatment for how I will use it. And I said, actually, the best way to do it is you just spray it on top of the grafts. And that's it, because you have the channels open right now. You don't have to microneedle it the normal way. You just spread it over, and then you will do it, once a day after. So the second, not the first day, the second day. So if you do it today, then the second day you start this. So what they did, they're very smart. So they took the vials we have and they put them in a sprayer that does mist. And they give it to the patient, and then the patient will go home and go like this. And they told them do a wash. And they didn't explain to the patient what it is, I think, but from what they told me. So they spray it on top of the graft area like a mist. And they found out that after 3 days, the redness and the pain had drastically went down. And then they found out that the growth also actually faster doing this way than a normal waiting for the hair to come to grow. So they start doing this, and I didn't meet them until almost a year later through a conference, and they were showing me results and we were discussing it. And they have a protocol, I think, done in their clinics right now, and the results are fantastic. Now it's done also in the US, some in Dubai, some in the US, some in Japan. I think more in Japan also, they do that. And they use it as topical, as post-treatment, and to speed up the process of healing, as well as increase the growth, the graft things. I have not done it myself. I know that people do it, and I know how much they buy and how much their protocols are. So some people just use the dropper. In the US, we use the dropper, so we don't use a sprayer. But in Turkey, they're very nice. They know how to do the droppers, and they empty it, and they have the labels of the clinics. It's nicely, you look at it like, wow, I like this, and it's actually this is how they do it. So every day you spray it once or twice, and the healing is quite significant.
10 days after the surgery?
1 day.
Only 1 day?
1 day after the surgery, yes.
Question. The examples that you showed are all connected to healing or inflammation process that is already there, like the acne or the diabetes wound. And then there is kind of a basic activation of healing process. And then you can assume that your growth factors are interacting in a clinical situation which is already active. Do you get the same result when there is no inflammation or healing process?
Yes. So we have the active serum is used on a daily basis. So use it twice in the morning and at night. It's like a skincare regimen, and then also for the eye treatments. You don't need to have inflammation. You don't have to have modality. It's just a topical application, and it works really well. Actually, this is how the company started, and then we developed the next component for medical use. But originally, it was a topical use. The one I showed for the cancer, that was the topical use. So you really don't need inflammation or modalities to do this. Usually, because I'm talking to professionals, I'm talking to practitioners, I'm giving you something that you use in your clinics, application to understand. But the majority of the sales comes from topical use for the active and the eye serum. They're quite popular.
Yes. How many different preparations of this product do you have?
Right now we have 6. In Israel, 5? 5. So I didn't talk about the vaginal product. It's not registered. It's in the US. It's in, I think, France, Japan, I don't know, countries. But the vaginal is one of the top sellers for us, and we don't even advertise it because we cannot produce enough of it. It's an amazing product. But and we have another one that also is not here called the Endotest. It's a preparation, but that's under the therapeutic company. It's not growth factor. It's a sequence of peptide that increases natural production of testosterone. It's not a hormone, but it's like it's also quite popular in the U.S. Again, with production restraint, we're not producing enough. So the U.S. market, the U.S. and U.K. consume around 90% of it, and the rest. So my people told me, don't talk about these things and don't show them because we have more problem coming from that way. But I think if somebody like you, probably in the US, you're going to hear about things that they don't hear about them here because of that. So you have 6 in total that under the aqueous constitution, plus the filler that we just launched 2 days ago, which is and hopefully next time I come here I'll talk about it. But now I don't think the other one we talk about it because it's not approved and it's not here yet. Probably it's going to be here next year sometime.
Thank you, Doctor.
Yeah, it's the first smart filler in the market. We just got it approved. It's just sold. It's quite a phenomenon. I think it's when I come here and talk about it next time, you're going to see me smiling with a big thing. But it's quite leap in terms of technology and fillers. Technology. It's the next generation. It's something that an injector that uses will know about it. It's quite sophisticated.
I don't understand what about the vaginal product. It's for atopic vaginitis.
So it's yes. So the interior, the inside of the vagina is an epidermis, squamous epidermis cell. It's actually, if you think about it, it's topical in terms of histology, in terms of physicality. It's not topical, but it's a growth factors preparation, different than the one I showed you. You apply it to the vagina, and what it does, it increases the circulation, it tightens, prevents hydration. So in America, for example, 40% of the women above the age of 40 suffer from dry vagina syndrome. Before we use estrogen ointment to treat this type of condition, but now what?
I'm a gynecologist.
Yes, so so yes, so this one we use it's a growth factor that works really well with pigment, with hydration, with dryness. It's increased the blood supplies, it tightens, enhances sexuality by 70%. It's very, very popular. Very popular.
I like the product, especially in the face, hyperpigmentations, melasma, something like acne, and very, very hard acne. I really use it. Thank also to Nidal. He is very good. He's very good. He's helped us a lot. And thank you, Nidal, and thank you also for the company. Big thanks.